What do you think, Catherine? You ready?
Let's do it. Let's party on mental health.
Okay, great. We're excited to have everybody on here. Just a couple fun facts as we get going about today's webinar. We've had 115 people RSVP for it across 15 different states from 32 tribal entities. So super cool to see that much participation. People excited to hear you speak. So no pressure, Catherine, by the way. Okay, we'll get going. So welcome everybody to our tribal mental health webinar. We're beyond excited to have Catherine on here to go through this today. I'm Don Dunn. For those of you that I haven't met, either in person or maybe on Zoom calls, I'm the Chief Commercial Officer here at GBS. And I just first off want to just say a huge thank you to Chloe Lloyd, who heads up our sales operation. She has organized this webinar and has done a fantastic job. So if there's any technical difficulties, we'll blame me, not Chloe, right?
Good way to go.
Yeah. So in introducing Catherine, which is quite impressive, and I'm sure she's not going to want me to read all of this, but I'm going to because everybody needs to hear what a rock star she is. So Catherine Van Tassell, she is the Behavioral Health Director here at GBS. She holds dual master's degrees in both social work and physician assistant studies from the University of Utah. Go Utes! She is a licensed clinical social worker and a board certified physician assistant specializing in mental health and lifestyle medicine. She has extensive experience in diverse clinical environments, including both inpatient and outpatient settings that has helped her develop a well-rounded clinical expertise. She's also a certified personal trainer. Are we going to be doing anything around that?
Yeah, we're gonna do some more jazzercise.
Okay, we're going to do a little jazzercise at an intermission, so that's great. Accredited by the National Academy of Sports Medicine and holds a Precision Nutrition Level 1 coach certification. Catherine co-teaches the psychiatry course for physician assistant students at the University of Utah and practices medicine at Moram Medical, focusing on disease prevention and reversal through lifestyle medicine. She, as the Director of Behavioral Health here at GBS, she consults with clients on their employee mental health needs, provides mental health trainings, including mental health first aid. She advises on policy changes and implements effective mental health solutions. As part of her professional training, Catherine volunteered at the Rape Recovery Center and the Urban Indian Center of Salt Lake, where she contributed her expertise, support, and empower individuals in need. Catherine has pursued additional training, earning a certificate in integrative medicine from the University of Arizona and completing plant-based nutrition and evidence-based optimal nutrition certificates from Cornell, the T. Colin Campbell Center for Nutrition Studies, and Harvard School of Public Health. She is also a diplomat of lifestyle medicine through the American College of Lifestyle Medicine, and Catherine's expertise has been featured in numerous podcasts, articles, and seminars, which she has shared insights on nutrition, mood disorders, addiction, and lifestyle medicine. And on top of all that, she's just an amazing, fun person. When Catherine's in the room, she lights up the room. You'll see that today. So Catherine, we'll turn it over to you.
Oh, thanks so much. Well, hopefully nobody fell asleep in those first couple of minutes. So if you're still with us, perfect. We can be done now. Okay, let's get started. Again, thank you so much. I was saying at the beginning, thank you so much for coming. I'm really excited to be here to talk about mental health. The one thing I just kind of want to set the stage with at the beginning, so when we talk about mental health, I still think there's a bit of a negative connotation. We're changing that. I think some of that's still there, but I'd like to change the way we think about mental health and considering that we're just thinking about our brain and our brain health. And why that's so important is because, well, first of all, we all have a brain, and all of us, we want to be mentating well, being able to retrieve thoughts and memories, having a good mood, feeling energized and motivated. And all of that comes from caring from your brain. That's with us individually and then thinking about in the workplace. So maybe today we could think about just how are we caring for our brain? We talk about caring for our heart, but what about our brain? So, um, just to kind of give you an idea of what I do in GBS, Dawn gave a nice description in my bio, but I just kind of wanted to point out some of the things that I do here so that if anyone needed to reach out or wanted for me to help them, I would be happy to do that. And here's a little bit of what I do. So basically, when I'm working with one of our clients, they come to me and we do a bit of an assessment. What is it like to work in your workplace? How are people doing, feeling? What are you seeing in absenteeism, presenteeism? We're seeing that an increase in disability because of people with major depressive disorder. And nationwide, just to give you an idea, if we continue at the rate that we're going with major depressive disorder and disability, it's going to be the leading cause of disability in 5 years in 2030. So this is really impacting us in the workplace. So, okay, what is it like in your workplace? We can do surveys that I've curated, but it's very custom. And some people want to do a deep dive, and for others, that can be overwhelming. And so thinking about, okay, where's somewhere small that we can start working and have maybe a 1 year, 2 year, 3 year, 5 year plan of more and more initiatives. Also thinking about what outside entities could I or should I be working with? Thinking about mental health vendors and EAPs. But that space can be overwhelming. 1,000 EAP or mental health vendors comes on the market every year. So knowing who I should be getting, what features should I be looking at? For example, when you're looking at a mental health solution, are there therapists 1099 or are they W-2? And why does that make a difference? Well, what we see with some solutions that have a lot of contract workers is that there's a high turnover. And the last thing that you want is to have an employee engage in one of those solutions, start to see a therapist, and that therapist leave. It is one, difficult for some people to make a connection with a therapist, two, even to make that first step. And then if they start and there's a high turnover, that could be very discouraging, and then they just leave. So talking about that. Also, there's many different offerings for these, and some don't fit for all organizations. We look at mental health policy review, your behavioral health claims, what that looks like. So at GBS, we have this ability to really now I don't do this. We have a whole team that collects that data, but then gives me just the data on behavioral health. So for instance, I might see an organization that has really high substance use claims. Okay, well, what can we do here? This is something that we need to start focusing on. Or generalized anxiety. You get the idea there. So giving those very personalized recommendations. And then, like today, I do lots of seminars, trainings. So I'm certified to teach mental health first aid, Vital Cog, which is a suicide prevention specific to the workplace. And then what you'll see today, and what Dawn was talking about in my introduction, is that I have specialized in lifestyle medicine. Essentially, what that means is it's this integration of Western medicine. So I still prescribe medications. I'm also a therapist, so provide therapy. But we have a lot of evidence-based strategies in how we sleep, eat, move our body, connect in our community. And we know that that impacts not only our brain health, but our heart health. And so I have a lot of trainings on sleep and mental health, movement and mental health. The reason why that's really important to bring that into a workplace is because we can come in and talk about mental health, and we should, but not everybody's going to engage in that. But there are a lot of people that might engage in, hey, I want to come and listen about sleep. I want to come and listen about movement. And just to give you an idea about that, if I prescribe a medication, there's something in the medical world called a number needed to treat, meaning that for all medications, we have this number needed to treat. how many people do you have to give this medication to for it to make one person well or better? And our medications aren't perfect. They still are great, and some of them save lives. But the number needed to treat is between 5 and 8, looking at the studies for an antidepressant, meaning I have to give it to 5 to 8 people for one person to get better. It's not perfect. Unfortunately, I wish it was. But the number needed to treat if somebody starts moving their body is 1 in 2. So this is where we just really get this powerful synergy in using all of the tools in our tool belt. And these are things that we can bring into the workplace, increasing people's opportunity to move. And that makes a difference in how they concentrate and focus during the day, how they feel. So these are some of the trainings that I do, seminars that I give. And I've gotten a lot of really great feedback there. Okay, so I just wanted to set that stage of all the opportunities to engage with me at GBS. So now today, we're going to just talk about the current mental health landscape and the impact of stress and mental health on our lives. And again, I really want this to be something that you learn and have something that you can take away that you can use today. And at the end, I would love for you to put that in the chat, or we can chat about it at the end. Again, I can stay and talk about that. But in terms of the workplace, as being leaders, I also want you to be comfortable in recognizing mental health challenges in others, what some of those signs and symptoms look like, how to speak to that, and then resources. This is not a training to train you to treat other people. That's not your role. Your role is to recognize, feel comfortable addressing it, and to be able to talk to them. Now, we only have this hour together, so that's a lot to cram in. Again, I do a full training on mental health first aid. That's a full day. If anybody's interested in that, I'm happy to chat with you about that. But we'll hit some of the high topics today. And again, hopefully there's something you can take away. And then, you know, we have populations throughout the world and in our nation that we see are disproportionately impacted. And most certainly we see that in the Native American population. And you don't need me to tell you that, you're experiencing that. But again, this importance of getting this message out. And, you know, thinking about, unfortunately, people aren't getting care for mental health or substance use across the board, no matter where we are. But again, seeing that statistic is even worse in the Native American population. So if we look at just a 2019 statistic, only 13, almost 14% of Native American adults received mental health services. We're just not doing good enough as a nation. And SAMHSA, so this is our government entity of mental health and substance use, reported in 2022 that Native Americans are more likely to binge on alcohol or engage in heavy alcohol use. And we're also seeing a rise in overdose deaths, and we saw it increase by 39% from 2019 to 2020. This is not okay. We see that there are barriers to care, lack of access to care, stigma, and mistrust. So there are a lot of reasons and opportunities, though, for us to intervene in leadership roles. And so I never like to look at the glass half empty. I like to look at it half full. And one of the things that I think is the biggest, is one of our biggest tools, or our best tools, is education, knowing why somebody might not get care, because then we can address it. And so thinking about economic stigma, lack of access to care, maybe a mistrust in the medical establishment, where is that we can recognize that and then make a change? So just what is the definition of mental health? Well, I think it's different from everyone, but I do think the World Health Organization has a pretty good statement on it. The reason why I like this statement is because they're not saying that this is just somebody who doesn't have depression or anxiety. Their definition is somebody who realizes their full potential. That's different than just being without a disease. Again, we are not our diseases, whether that's a brain condition, a heart condition, something else. We're realizing our own potential, that we can cope with normal stress of life. Stress isn't going away. We're all going to have it. It's here to stay. And stress isn't necessarily bad for us. Stress is when it's unmediated and that we don't have ways to cope with it. And then that we can work productively in our lives. And we also are able to make a contribution to our community. Being in community is so important, and all of us are being pulled out of community in our very fast-paced tech world. So just across the board, 1 in 6 youth are struggling with a mental health condition every day. 1 in 5 US adults experience a mental health condition every year. And we have to consider these numbers are reported numbers, and we know not everybody is coming forward. So these numbers are likely underreported. And then, unfortunately, what we see is that people with a mental health condition, that they are using maladaptive coping skills. And one of those can tend to be substances. So we see this high rate of people with a mental health condition also have a substance use condition. And just kind of going along, I think every single one of you, if you were to come and tell me, you could give me a whole list of things in your life that are stressing you out that were not lack of stress. I mean, here's a list. If you didn't have one, I have one for you. Some of you will identify with some of these and could add your own. But the idea is, again, thinking somebody may not have a mental health condition, but they're still having some sort of stress in their life that's impacting their brain, that impacts how they show up at work, that impacts their health, and that also impacts us in the workplace. And that's because when we see stress on the body, it basically hits us from head to toe. So our brain, we're talking about that today, but also our stomach. When we go into this fight or flight, or we release a lot of stress hormones, called cortisol being one of them, it shuts off our GI tract, meaning we don't digest our food, we get a bellyache. There's a lot of changes that can happen, and that makes us feel unwell. It impacts our immune system, our heart health. If we are in a fight or flight state, our heart rate goes up, we start breathing faster. You can see that in your pulse. And then that's more pressure on your heart. More pressure on your heart. We know that heart disease is a leading cause of death in America. And so, again, we see these negative impacts in physical conditions from our brain. It can even impact our reproductive system. And then when we think about our brain, I love this infographic. It's a bit busy, but I just want to point out 3 areas of your brain. And I think once you understand this, you will never think about your brain or stress the same way. And this will be a very useful tool. So I want to think back to when you were a teenager, or if you maybe have teenagers right now and you're very much immersed in this. And what I say and mean in this is that before we are 25, we don't have a full working frontal lobe. And when you look at here on our little slide here, our frontal lobe, this is our thinking part of our brain, and it's the center of logic. So how many of you were either told as a teenager or early 20-year-old, what were you thinking about some of the harebrained things that we did? I mean, I most certainly could say that. I jumped on a moving freight train before I was 25. We could all go down and share, I'm sure, very, very funny stories. And you're just like, what was I thinking? Well, it kind of wasn't your fault. Your brain, the logic center, hadn't fully developed. So many of us make so many choices, like who we marry, where we're going to live, what college we're going to go to, what our career is going to be. We have kids, but all before our logic center of our brain is developed. Okay, in the middle of your brain, you have something called your amygdala. So I like to call her Amy for short, and I want you to think about your personal little Amy now moving forward. And the Amy in your coworkers are the people that you lead. She's very important. So Amy is kind of like where stress lives. And she's basically the guard of your body. So if something dangerous were to happen, let's say you're in a movie theater and somebody came in yelling fire, your amygdala or Amy would set off the alarm to your body and you would go straight into fight or flight and you would shut off the frontal part of your brain, that logic becomes clouded. There's a second part of your brain that also becomes impacted, and that's your hippocampus. So your hippocampus, think about a little hippo with librarian glasses on. That's how I remember the hippocampus, is our very own little librarian where we store memories. It's really important for our concentration. So when we are under that fight or flight, that emergent state, Amy sets off this alarm in our body and we shut off the logic center and we also shut off the hippocampus because basically we're just going into survival. Here's what we need to do. We need to be safe. And that is my number one focus. It's not learning new information. It's not retaining information. It's not listening to a seminar. It is not listening to my boss. It's not getting my work done. It's not concentrating. And unfortunately, what we're seeing in our world today, because we do have this long list of stressors that are impacting us, and that people are reporting stress as their number one concern, it may not be that person that yelled fire in a building. It's this laundry list of stresses that we have that Amy is getting these false alarms to turn on the alarm and shut our brain off. And that's why we're seeing this idea of presenteeism. So people are coming to work, but they're just like checked out, or it's difficult to retain information. And we're also seeing that in other ways that our bodies are impacted and how we're not caring for ourselves very well, like sleep. We are sleeping 1 to 2 hours less than we were sleeping a decade ago, which also impacts our brain. So again, thinking about this slide, I just want you to think about Amy and how we mentate. So how we can focus, how we concentrate, and how we retain things that we learn moving forward as we talk about stress. And when we don't pay attention to this is the one thing that I always say is that if we don't, we can ignore it, but we're going to pay for it because then it leads to burnout. And just like anything else in medicine, is that if we're not preventative and we then end up fighting something that's chronic or after it's happened, then it's harder to get back. And we see that in burnout, that stressors, they're not managed, nearly everything becomes impossible. So in the workplace, what are we seeing from this? So again, thinking about what we laid out in terms of the laundry list of stress that everyone has, add their individual stress, how our body reacts to stress. You saw that fight or flight image, and then your brain. What is this turning into in the workplace? Well, again, people are stressed. 1 in 3 American workers suffer from chronic stress. So not just some stress, chronic stress. And $27 billion of worth of work days are lost to mental health. And again, remember I said, if we continue on this trajectory, that by 2030, major depressive disorder will be the #1 cause of disability. So now that you understand your brain, you understand your body, we're seeing why job performance and productivity is impacted. Our engagement, communication with coworkers, just kind of more on edge, maybe not listening, not doing a good job in that area. And then just our physical capability. So just some questions to think about today is, what is it like to work in your workplace? And have you or someone in your community experienced a mental health condition? I would say because you guys signed up that everybody here has. But again, how is this impacting your community? And were you aware of resources? Did you feel like you were equipped with resources? And how easy was it to access care? So like any health condition, from diabetes to heart disease to cancer, the best outcomes is when we can access care quickly. And we're able to do that in a reasonable way. There's not barriers to that care. But we see a lot of barriers and a lot of delay to mental health care. So again, this idea, what are all of the tools that we have? because we're not going to fix the mental health environment tomorrow. So what can we control right now? And as being a leader and thinking about mental health, one of the nice things about mental health becoming more at the forefront of things that we're discussing is that we're seeing more research come out. And so there are bodies, including Mental Health America, that is one of the leading bodies of work in this space that are actually tracking what is moving the needle in organizations. Look at their website if this is interesting to you. They actually have something called the Bell Sill Award. They give that to organizations that are really forward thinking and doing really good work in this area. But what they see are areas to work towards, or what we should see as being our benchmark in terms of good mental health examples in the workplace, are that leadership is having conversations regarding the importance of mental health, that they lead by example. If you see your leader caring for their mental health, that's going to feel safe for somebody that is being led to then care for their mental health. There's lots of opportunities for ongoing education and resources. Bring me in. Let me do a webinar or seminar for your organization. Do you have an EAP right now? Most of them have a whole list of presentations that they can do. What resources can we bring in and provide education? Create a safe environment. Have regular check-ins with people. This could be at the beginning of your meeting. So at the beginning of your meeting, maybe doing a high and low. This really gives you an opportunity to see the temperature of how everybody is doing. Are they feeling really overloaded right now with their work? Or does somebody have a sick kiddo at home and they're not sleeping very well this week? Setting clear and realistic expectations. And again, this investment in education and training. And I love this little cartoon. Helen, you're the team leader, so you're going to jump first. That is our role, is to lead by example. But unfortunately, when we see surveys of how people are feeling in their workplace, they don't feel like these things are happening. So 3 in 5 employees agree that their manager cares about their well-being, and 2 in 5 employees report that their manager encourages them to take time off when needed. And we're just not empowering our people either. So 2 in 5 employees are not comfortable providing feedback to their manager. And then I think that this is also key, is employees don't know about company mental health services. So again, remember your amazing brain infographic. This is one thing I want to highlight. When people are stressed, remember the librarian, our Hippo librarian, they check out, meaning that you may have told somebody about an EAP or a mental health resource in your organization. Probably you felt like until you were blue in the face. And then they're like, wait, I didn't know we had that. Just remember, when somebody's brain is stressed, that retention is just not there and they're in survival mode. So this is just an idea of how do we make our resources internally available all the time, and like it's in the bathroom, on the bathroom stall, it's in the break room, it's on if you have a remote employee work place, do you have a Slack channel just for mental health resources? Do you have your own personal website that's on as well? How can we just keep this information just right front and center? And then talking about that it's confidential. That's the other part. EAPs are confidential. They legally have to be. But people don't know that, and they're worried, oh, if I engage in this, am I going to be judged? And so really making that message clear. Okay, so part of our objective today was just to talk about what would be some warning signs. What does this look like? And so I want to just run through a few of our key, most common mental health conditions, and major depressive disorder being one of them. Also the idea, remember I was talking about brain health. So we can have a couple of these symptoms and they can come and go. That doesn't mean we have major depressive disorder, but that may mean it impacts us in season to season. So it's good to think about this. People that suffer with major depressive disorder become quite sad, cry a lot, maybe very irritable, changes in how they sleep, sleeping more or less, eating more or less, and just feeling very down. Our energy is down, our motivation is down, our interest in doing things that we like is just evaporated, and we feel no way out, guilt, hopelessness. Nobody else feels this way. We're all alone. We can have headaches, backaches. Depression really impacts us physically, which we don't really, I think, appreciate enough. And then it can get to the point where we just feel this is too hard. It would be better if I wasn't here. And unfortunately, we're seeing our rates of people become victim to suicide increasing year after year. And anxiety. This is more where we see in depression slowing down. Anxiety, heat up, restless. I can't sit. I feel very nervous and anxious. I always have this gut ache. My brain is always going. I'm thinking about the same thing over and over and over again. You ask me anything, I'm going to snap. And again, physical symptoms where we see this muscle tension and then changing in our eating habits, whether we don't eat or we're just stress eating all the time. And then it is very difficult to concentrate when we are impacted by anxiety. It's like our mind is going blank. So here's the first of many resources. You also have at the end, you'll have a handout that you can access as well that has all of these. So don't feel like you have to write them down. You can just be very mindful and sit through this presentation. But I want to just review them so when you get the handout, you're not overwhelmed by, oh, what am I doing with all of this? So Mental Health America has take a mental health test. Now, this is obviously not supposed to replace a clinician or somebody giving you a medical diagnosis. But again, this is a resource where somebody could go in the privacy of their office, their home, their phone, wherever they are. And, we saw, oh gosh, I've noticed a couple of these symptoms, or you notice this in one of your coworkers. Hey, why don't you check this page out and see, is there something maybe you need to look into? Kind of this screening, if you will. And you can do it for depression, for postpartum. That's the other thing we need to think about is our women coming back to the workplace with new babies, anxiety, substance use, PTSD. There's a whole slew of them that we can take. Again, building this awareness, resources, and education. And then I mentioned that unfortunately, we're seeing higher and higher suicide rates. And what does that look like? Well, again, we're just covering the surface of this. We have some trainings that are a couple of hours on suicide prevention. But just to think about warning signs, people talking or writing about death or dying, threatening to hurt themselves, kill themselves, looking for ways to do that, showing anxiety or agitation, changes in your mood, changes in their sleep patterns. And then when we look at suicide research, what you see is that people didn't want to die. That was not their intention at all, but they felt like they had no way out. This was their only option. They had no sense or purpose. And so what we will also see is that somebody may start stockpiling medications. Maybe they get a gun, they access a weapon, and they make a plan. And then the last one that I want to touch on is substance use disorder. So substance use disorder, we can see in many ways impact us. But taking in larger amounts of substances, using them in a way that is dangerous for ourselves or for others, wanting to cut down on a substance, but not able to, maybe needing to use more of that substance to just even feel normal. We can see that people start drinking in the morning because they start going through withdrawal. So you're becoming physiologically addicted to the substance. And then you're not managing your relationships, your work. You may even be engaging in substance use in a dangerous way in environments that are not safe. So when I was talking about the beginning, we have all of these tools, but sometimes we're not utilizing them. Um, we really want to think about, okay, how are people in their community? Do they have a community or are they isolated and lone? How are they moving their body? I talked about 1 in 2 people will improve their mood from moving their body. Do they have, are they eating a nourishing diet? We know that there's a whole field called nutritional psychiatry. 60 to 70% of our food today is is uh, is ultra processed food, and that's impacting both our mental and physical health. And then also thinking about the population we're talking about today. Are they in a food desert where it's difficult to access food? And being able to recognize that. How are they sleeping? And then what about any type of spiritual or a religious practice that they have? Just meaning that they have some sort of higher power or something that brings them some mental comfort as well. These are all tools that we can use to make us both healthy mentally and physically. So I have this little story that I like to tell because I think that this brings this into perspective. And for time's sake, I'm going to shorten it a little bit. But the idea is that mental health is different for everybody. And when antidepressants were first being introduced in Asian countries, there were doctors from other countries that came to help the psychiatrists be able to prescribe them and manage side effects and titrate them. But they were told this story because the Asian psychiatrist said, one of them said, "We already have antidepressants. We don't need antidepressants." And so they said, "Well, tell me about that." So there was a story shared about a man who was working in a rice field and had stepped on a buried and explosive device. And that device had gone off, and sadly, he lost his leg. This sent him down this spiral of not being able to work anymore. He tried, but his prosthetic leg would get infected from all the moisture that was in the rice field and became very painful. It was always infected. And so he basically ended up just staying in bed all day and was very tearful and crying, some of those warning signs that we saw. And this is because he lost the ability to care for him and his family, his purpose in life, his community. He would be out there working with his friends and he would be sharing experiences like we all do within our work in our community. And that was all taken from him overnight. And he became incredibly depressed. So his psychiatrist gave him a cow. Okay, why a cow? Well, he could milk the cow with his prosthetic. That meant he had a way to provide for his family. He was back in the community selling his milk. He had purpose and meaning in his life. All of those things that had been taken from him were replaced by getting this cow. Now, of course, a cow is not going to make everybody happy, but the idea is, what is going on in somebody's life? What is happening? And how can we creatively bring in other resources? And so there is a time and a place for self-help and like our own self-care strategies. And then there's a time for clinical care. And both of them can work together. And this is an example of just some of the ways that we can provide care for ourselves. And I just want to highlight why this is important, that we think about how we move, how we eat, the hobbies we have, our community around us. Our relaxation techniques are so important. So I mentioned at the beginning about exercise. We kind of talked about that. I actually have an entire hour seminar on exercise, the science behind it, and mental health. But let's look at just this one study that came out of Harvard. And individuals that had never meditated before, they meditated for 27 minutes a day for 8 weeks. That's 2 months. That's like a blink of the eye. I mean, tomorrow it's going to be Christmas again. We all know it. What they saw is, now you understand your brain from the slide. is that people who meditated for 27 minutes a day for 8 weeks, just 2 short months, that the gray matter in their hippocampus, remember your hippo librarian, it actually grew bigger. It grew bigger, which meant that they had more self-awareness, compassion, introspection. And remember, that is our librarian. The other thing that we saw, Amy, the little emergency system in our brain, decreased in size. Now, I want to here's a little call out to pay attention to right here, a little hot tip. Thinking about who we are who we are engaging with in our communities, somebody that has had a high level of trauma or stress in their childhood growing up. So think about parents that fought a lot, maybe got divorced, there was violence, they had food insecurity, a parent maybe went to jail, there was sexual trauma. Their amygdala in their brain is actually bigger. It can grow bigger if there's a lot of trauma in your childhood, meaning that as you get to be an adult, you just tend to be maybe more anxious, fearful, depressed. You're just predisposed to that because of these brain changes. But we saw with meditation is that gray matter, that actually got smaller, which played this important role in anxiety and stress. The other reason why I want to point out that this is so important is, I would say a great majority of us have 27 minutes a day that we maybe sails out the window to social media or to TV or whatever that may be. What an powerful, free tool that we can do anywhere is meditation. And I don't have one medication that I can prescribe that is powerful as this. Okay, so again, hot tip, what are some takeaways? What can you use today? Well, there's lots of mindfulness apps out there. Here's just a few of them. Some are paid and some are free. Again, you'll get this in your handout, so you'll have it. But here's something that you could provide to somebody or use for yourself. Somebody said in the chat, I also want tools for myself. Okay, but there's also professional help, and that clearly, for some of us, as much meditation as we do, that's not going to solve the problem. We need a social worker, we need a doctor, we need a substance use professional. And so here's a little way that you can think about this, and I wanted to make this easy for you to remember when you're working with somebody and you're starting to recognize some of those symptoms that we talked about earlier. So think about the word cares. Break it down into one, I'm just going to listen to this individual. So all I'm going to do is just provide some non-judgmental listening. The reason why this is so important is because I think a lot of us think, what if we say the wrong thing, or I don't know what to say? And let me just tell you from a therapy standpoint, sometimes the best thing we can do is not say anything at all. We always want to be assessing for risk and then providing reassurance. You as an HR, a people leader, you're not a therapist. You don't need to be a therapist. All you need to do is listen, assess for risk of harm, and connect them with the appropriate resources and give them the power to do that. And also, again, knowing what their support system is. And so what could that look like? Well, we looked at warning signs. So you'll have this in this PowerPoint, but we see people changing. We see their change in how they show up to work, how they feel, their clothing, their appearance, their concentration, struggling with focus, not being able to make a decision. These are all examples of how somebody might change in the workplace. And when we start to pick up on a pattern, right, one person can do one thing one day. That's not a pattern. But if we start to pick up on a pattern of a few of these or a handful of these, this is where we want to have some compassionate listening in a conversation and saying, hey, I'm worried about you. I recognized one or two of these things. And again, having a tool here on how to start a conversation. here is a resource for you to do that. So there's this website, 1 in 5. You can get that from the little QR code here. But a couple of ideas thinking about, are you okay? I've noticed that. How are you really? Because we tend to always just say, oh, I'm good. That's our first reaction. Okay, wait, let's not just let that first reaction. Maybe let's check in a little bit more. Do you want to take a walk? Let's get out of the environment. Let's go outside. Let's be in a private place. So when you have this conversation, obviously putting your computer away, your phone away, not worrying so much about what you're going to say, but just thinking about the C and cares, compassionate listening. I'm just going to listen. I don't need to offer advice. That's not my role. My only role is to get them a resource, make sure that they're safe, and do they have community to help provide support. So please visit this website and look at more ways to start a conversation. And then when we looked at C, care or provide listening, assessing for risk. Here's a little logarithm that you could go through when you're thinking about a suicide risk assessment. So some of the misconceptions that we have in suicide is that if we ask somebody about suicide, that they might move forward on that. And we know that that's not true. So it's okay to ask the question, are you thinking of killing yourself? Are you thinking of suicide? And then if they say yes, do they have a plan? Do they have an ability to do that? Meaning if they stockpile medications, do they have a weapon? Do they have means? If they answer yes, this person should not be left alone. They either need to go to the hospital, we need to call 911 or 988, our national suicide crisis line, because this is their highest, they're at their highest risk if they have a plan and means. So if they don't have a plan or means, then we're looking at getting professional help. But just an idea when you're thinking about assessing for risk. And so 988 is the National Suicide Prevention Line. But out of the state of Washington, they have an initiative called Native and Strong. And even if you're not in Washington, you can still use this. So if you press 4, this is specific to Native American populations and has been put into place. You can also go to their website, Native and Strong, for more information. And then another resource is We Are Native, and this is specific for Native youth. And there's all sorts of information here. And I was perusing the website and think about lifestyle. They have posts on exercise, on sleep. And you can see from here, from the top, you know, there's an ability to ask questions, talking about my culture, my life, my relationships, my mind. I mean, many of us could go back to thinking about being a youth. And I did not grow up in the time of social media, and I am so thankful for that. Because I think that there are a lot that kids have to navigate just outside of being in a place where our brain is trying to develop and we have all this stuff coming at us. And we're seeing in the research that that is proving to play a negative impact on youth brains. And especially what we're seeing this is even more of an impact in young girls. So this is another resource for you to use. And then Stronger Hearts Helpline. This is specific. This is a Native helpline for domestic and sexual violence. So again, what are these little tools in your pockets that you can use when you're listening to somebody? Are they maybe having a kiddo at home that's struggling? Could this resource help them? We have our 988 emergency line if we need that. Somebody unfortunately experiencing domestic abuse, where can we get them hooked up? You don't need to be their resource. And then also there's IHS.gov. You guys may be aware of this. I have been on this website. It is most certainly not perfect. And unfortunately, there are not resources in every area across the United States. but at least it's a place to start and to be able to see if there are resources in your area, because again, as many tools as we have. So put in your state and on the map, it will show you. Unfortunately, there's a lot of areas, again, that don't have resources, but looking at that is one of our options. And then just in terms of other resources that I tell people about all the time, Live on Utah, this is in Utah, but it's not specific to Utah. No matter where you are in the country, you can use this. And what I love about this resource is it's great for education, for suicide prevention. So this is a suicide prevention platform, and there's so many resources. So faith, youth, workplace, fire safety. Also, what I think is my most favorite about this resource and why I always talk about it is they have a web-based tool, and also on Instagram, they have 10 little video modules that you can go through. If you do the whole thing, it's like an hour. So it's not too time intensive, and you can just do it, when you're waiting in line at the grocery store, or just, when we're always picking up our phone and checking it for no reason. There's professionals that talk about suicide prevention, people with lived experience that talk about suicide prevention. And so the point of it is to give education and resources. And if one completes the 10 modules, they just send a message to Live on Utah, and they become a Live on Utah ambassador. Now, in the workplace, if 80% of your workplace does this, then you as a workplace becomes a Live On ambassador. So here's a tool to use if you're wanting to bring in more mental health initiatives and more awareness. Hey, let's do this as a team building activity. And then I like this website. If you know anybody that has been struggling with suicide or family member, this is a very beautiful website. It's called Live Through This, and there's stories of people that have all had lived experience with suicide. And the thing I love about this most, and what you may take away from this picture, is if you look at this, it impacts everybody. It doesn't matter your background, your race, your age, how much money you make. It does not discriminate. This is impacting us all. So somebody could go to this website and, hey, this person looks like me. I can identify with their struggle. I think it's a really nice resource. And then we talked about EAPs at the beginning of our time together and what that could look like. In your workplace, do you have an EAP? Is that something you should look at? And many of you, I'm sure, are very familiar with that, but in the case that you're not, this is a free confidential service provided by the workplace, and there's usually a number of visits, like 6, 10, or 12. But they can also give work-life resources like crisis childcare or elder care support. Also, if you have a crisis within your workplace, they can bring in a social worker and provide crisis therapy. I've had many organizations reach out to me that did not have an EAP in place, and they had a suicide in the workplace or some crisis, and they really needed to provide support but didn't have that resource. So I would say this is such a great resource in your work, and also knowing all of the things that they have available to you. Also, there are some EAPs that don't have a cap on therapy, on counseling. And that may be something good to use, especially if you have a workplace where a lot of people maybe are people facing, there's a lot of trauma. So libraries, for instance, their employees are almost first line workers, because a lot of people that come into community libraries have mental health conditions. There ends up being a lot of violence in libraries. This is something that I didn't know until I was working in this area. And so they really need a strong EAP. And so not having a cap on visits is very helpful for an organization like that. At psychologytoday.com, this is a great resource to find a therapist. So you can filter by sex. I only want to see a female therapist, a male therapist. You can look at specialties. They specialize in trauma, PTSD, anxiety, marriage. It's a nice way to narrow it down because finding a therapist can be incredibly overwhelming. And also, they have a picture and a bio. It's almost like speed dating for your therapist. You know, you can go through it and think, oh, I wouldn't connect with them. Nope, nope, nope. Okay, this person, I feel like I could have a connection with them. So a nice resource to help somebody. You can also filter by insurance, self-pay, telehealth, in-person visits. When we're thinking about rural populations, telehealth has been a game changer there. So again, always thinking about how can we access care quickly, and having a teletherapy option is a great option. And again, there's a resource nearly for everybody. We even have an organization called Man Therapy. I think their little tagline is very creative. It's okay to cry, even when it's not about sports. And then NAMI, our National Alliance on Mental Health, the American Foundation for Suicide Prevention, are both suicide prevention resources. Okay, I was hoping we would have more time together, maybe to go through a little case example, but we're running close and I want anyone to ask questions and I want to be respectful of your time. So I'll just summarize this. We were going to work through a case example with Jason, who was experiencing some of the things that we had talked about. So we're seeing he's avoiding social interactions with his colleagues. He's missing work on Mondays, arriving late and smelling of alcohol. The Monday thing is put in there because we do see people that are struggling with substances that they will show up late to work or not show up on Mondays or the day after a payday. So maybe just put that in the back of your brain. So seeing signs and symptoms of somebody, warning signs that may be struggling with substance use disorder. And we can see those here: the late appearance, impaired function, social withdrawal. And just highlighting, how important this is. You can estimate, from what we know, about 10% of your team will have a substance use disorder. We just see this across the board. And 1 in 11 people with substance use disorder actually get treatment. So if you're working with somebody and you're looking for treatment, SAMHSA has a treatment locator. And you can go onto that by findtreatment.gov, and you can find inpatient, outpatient, residential treatment centers. And also, I think that this is really, here's the good thing about technology. It's now we have things like in the rooms, faces of recovery, or local peer support where people can go on meetings on their phone. So again, thinking about a rural population, maybe they could go to an AA meeting at their lunch break instead of having to leave, or they don't even have access to doing that. Or you can get care from a doctor who can give you medications specific to substance use. And again, you'll have these in your handouts. And then substance use really impacts the family members. So anybody who's impacted by a family member, I highly recommend reaching out to Al-Anon. Al-Anon is specific for family members, loved ones that somebody who's has alcohol use disorder. Okay, right at 12:30. Here's the QR code for all of those resources that I went through. And again, thank you for taking time out. I don't have a time that I need to leave, so I'm happy to stay on and answer any questions. You can also reach out to me anytime. I'm happy to listen and to talk. And I really hope there was 1 or 2 things that you could take away from this. And if you want to share them in the chat, I would love that. I'm going to stop talking now.
Oh, well, thank you, Catherine. This was amazing. Just so everyone knows, the CE credits codes, just check the notes. Chloe just posted that, so you can get CE credits for this. And Catherine, thank you. This was so informative and empowering for everybody. So thank you. Appreciate everybody joining, and let us know if you have any questions from here. And then next time, Catherine, you can take us through some push-ups or some planks or something, right? We can use that personal training certification. We can put that to use.
I think we need a cooking class too from
And a
Catherine.
cooking class.
Yeah.
Exactly right.
I would love that. Absolutely.
And just to add, you know, because a lot of times it's tough to ask questions, especially when you're in a webinar environment like this. But like Catherine said at the beginning, if there's anything, you know, if anyone wants to reach out, wants to further discuss your EAP program or ways that Catherine might be able to help you or your employees or consult with you, you know, on what the best, you know, setup might be for you or how to deal with a particular, you know, environment you might have, feel free to reach out. She's an amazing resource that we offer. So yeah, don't hesitate to reach out.